Hello, everyone. I'm Patricia Debs, professor at Federal University of Espírito Santo, and I am the coordinator of this program, Info Hansen. And we have today a great pleasure to introduce you, Dr. Henk Eggens. He's a public health physician, and he's coming today to talk about capacity development, its importance in leprosy control programs. Dr. Henk, thank you for coming.
Thank you, Professor Patricia Debs, and thank you for the invitation to make it possible for me to give this presentation on Info Hansen. Capacity development is a subject that is very fit for to be presented in Info Hansen, because Info Hansen, as I understand it, is aiming to disseminate knowledge about leprosy and leprosy related subjects. So you are doing capacity development, so it's really very appropriate for me to be on this platform. Thank you, and your team also.
Oh, thank you. We need to thank you a lot. So yes, you can start from now on. Okay, I will disappear here from the screen, and you can present your slide on your own. Okay.
Okay, fine. So this presentation is about capacity development, and the capacity development is part of a solution to improve any poor quality of care and treatment for persons affected by leprosy. I will be using a simple analysis. It's called the whys, the 5 whys, to look at the causes of a specific clinical problem in this presentation. And I will also give an outline of some of the solutions that will come up once we have determined the different causes of this problem. Here's a definition of capacity development, and if you can read it, it is the improvement in an individual or an organization's capability to produce a product, or to perform or organize services. It's a very wide definition, but it is for certain that it involves human resources. There are a few more or less synonyms: capacity building, capacity strengthening, and if you are from another language, then I'm sure there will be translations in your language for this term. So what is the problem that we're going to discuss? If you work in leprosy, you know that skills and knowledge in all things related to leprosy are disappearing very fast. I've seen it in the past when I was in the field, and you probably notice it too. It's not today's problem. I read the WHO strategy, 5-year strategy 10 years ago, and it already mentioned the problem and the need to maintain qualified human resources to address all matters related to leprosy and leprosy control. And I'm not talking about the fields of the excellence centers like Bauru in Brazil or Alert in Ethiopia, or the different excellence centers in India and the rest of the world. No, I'm talking about problems in the field. And sometimes I'm talking about problems in the Ministry of Health. Also, Ministry of Health, the ones that I've seen in my work, sometimes, or most of the time actually, the leprosy control department is combined with others. It can be combined with tuberculosis control. Nowadays, there are a lot of ministries that have grouped neglected tropical diseases, which leprosy is one of them. And the staff who are running in the ministry, they have to be knowledgeable about all these different programs and diseases and disease control programs. So it's not easy to make everybody knowledgeable on leprosy. Now, I want to take you to Maria as an example of a problem. Maria is a leprosy patient. I call her Maria, and she was diagnosed with leprosy in a health center somewhere in the world. And she was giving NDT and she was collecting the NDT every month to take at home. After a few months, she started getting pain in her right arm. And the pain was so severe that she went to the health center again, saying, please help me. In the health center, they gave her paracetamol to kill the pain and an ointment to put on her elbow. And that didn't help. After a few weeks, the pain stopped, but then she started noticing that she dropped things. If she would pick up a book, she would drop it, or she would cook and pick up a cooking pan, she would also drop it. So that made her very anxious, and she was looking for help again, went back to the health center. The doctor in the health center said, I cannot help you. I don't know what this is. You have to go to a specialist hospital. Then Maria looked at him and said, but doctor, the hospital is 6 hours away and I don't have money for the bus. So she did not get a proper treatment because you would know that she was developing reaction and nerve damage. So this is the end result of what happened to Maria. Those of you who work in leprosy, you realize that it's a claw hand, and it's because the ulnar nerve was damaged and there was no treatment given for reversal reactions, and there was no care given for prevention of disabilities. And this is what happens. This is what can happen, and it happens all the time today, and it will probably happen tomorrow as well. Now, let's start to think about analysis. What is the reasons? Why did Maria develop a claw hand? And there is not one cause. There are several causes for this. And using a simple analysis, which is called the whys, we can find out what are the causes and what are the relationships between the different causes. Because we want to find the root cause of this problem, and then we can turn to look for solutions. Okay, the technique of the 5 whys is very simple. We define the problem, we did. It's Maria's claw hand, and then we ask why. Why is this happening? And we get an answer, and we ask again, why? Why is this? Why is this? And we do this several times. Officially terms of 5 whys. I developed 7 whys, which we will see later. And then we try to find the root cause. This why analysis is a simple one, but it's useful in this for this trying to solve this problem. And it's the basis also of what was 10, 15 years ago very popular as a problem analysis and planning tool called the Logical Framework Approach, LFA. The first part of this LFA, Logical Framework Approach, was to make a problem tree. You can see on the picture, a lot of problems were identified, and they were giving a sequence. One cause and one problem was the cause of another problem, etc., etc. Nowadays, the logical framework approach is not so popular anymore, and there are other methods, but the essence is the same, trying to find the causes and the relationship between the causes. So let's start the whys. We start with Maria's claw hand. Why is that? Obviously, there was no diagnosis made of a reversal reaction because the health center staff didn't know it, and inadequate treatment was given. Right? Poor diagnosis. Why was there a poor diagnosis? And there are several reasons for that, and 2 of the reasons are delays in a diagnosis. And we divide delays usually in 2 different types. It can be the patient or the client who has a delay, or it can be the health service who has a delay. Let me first talk about the patient delay, because I will focus later on health service delay and the relation with capacity development. Patient delay can have several causes. Maybe the patient doesn't know that something is wrong. There's no awareness. It's possible. Maybe he or she does not have access to health services. Maybe they are too poor, like in the case of Maria, she didn't have money to pay for the bus fare to go to the hospital. There may be other reasons that there's no access for a patient or a client to visit a health service. One example that happens sometimes, unfortunately, that if it's a woman, her husband says you are not allowed to go to the health center for reasons of his own. And the last one is also important, self-stigma. Especially in leprosy, many people are ashamed to show the disease and show the symptoms of the disease, and they will wait and wait until they hope that the problem will disappear on its own, which of course often it doesn't. So that's patient delay. The health service delay is the focus of today, and we'll ask the third question, why was there a health service delay in Maria's case? Well, maybe there was no health service at all. There are many places on earth where there's no health services available for leprosy, I mean, specifically. Or maybe the health services are there, but they are closed to leprosy patients. Myself, I've seen instances where there was a beautiful health center with beautifully new painted, and if you were a leprosy patient, you had to go in the back and be treated on the porch on the back side of the health service, because the health staff was afraid to mix leprosy patients with other patients. Another way that another form of health service delay may be that it's not affordable. Maybe you have to pay to get treated, and maybe you have to pay so much that you cannot afford it. And the fourth one, possibility of a delay, is that the quality is so poor, for instance, in the case of Maria, where the doctor could not recognize reversal reaction. The fourth why is poor quality of services. One of the reasons why is the poor quality is that there is no qualified staff available, and there may be many other reasons. The fifth why is, if there's no qualified staff available, why is this? Well, maybe there is staff, well, I'm sure there is staff, but they never had training in leprosy or in reaction diagnosis or reaction management. Maybe the staff has been trained, but they are not motivated. They are not interested in treating leprosy patients. It happens. There are poor career opportunities, or maybe staff doesn't get paid enough. So staff may not be motivated. And a third reason may be that they were trained 10 years, 15 years ago, and they forgot things, and the new ideas never got to them, so the training may be outdated. The sixth why, if the training was a long time ago, why is this? And there we get more to the root cause. Maybe the authorities didn't give any priority to training. Ministry of Health didn't provide funds, didn't provide trainers, and didn't organize training. So the people in the health staff, over the time, they lost the ability to treat Maria properly. And the third one is also important, and I will talk about that a little bit later in more detail. No support of supervision. Supervision is often a very neglected part of the health services, and as I said, I'll talk about that later in detail. But it can be a reason why the doctor in Maria's health center did not know anything about reversal reaction treatment. Seventh why, if there's no priority by authority, why is that? Well, you probably know that leprosy as a neglected disease, it means exactly that. Neglected meaning there's no funds, there's no priority, there's no attention, less attention, and there may be competition to address the leprosy problem in the ministry with other health problems. And some health problems are politically more interesting. Staff at the ministry are human, and they have a career, and sometimes their policies are not only defined by epidemiological reasons or health reasons or medical reasons. No, they may be, their priorities may also be shaped by their desire to go upwards or to be elected next election or any other reason. So that is one of the reasons why the leprosy and leprosy control does not have the priority that it deserves. Also, you need to lobby. People need to lobby for putting leprosy and leprosy control on the agenda, and that's also not always done effectively. So we are now at the root cause of Maria's problem and Maria's end result of her claw hand: lack of political commitment. I was trained in tuberculosis in Alert, Ethiopia in 1989, and professor there, Don Anderson, he said there are 3 priorities for any disease control program. First, political commitment. Second, political commitment. Third, political commitment. And after that, other priorities appears. And I still remember that because I think, and I still think he is right, a political commitment of those decision makers is the root cause of good or not so good quality of services. So what are the solutions? And I'm only going to outline them because there's no time to go into detail for all of them. First, of course, increase political commitment, and I will go into that a little bit further. Second one, improve the lobbying by different organizations to increase this commitment. And I'm not only talking about ministries of health and departments of public health and departments of neglected tropical diseases. I'm also including non-governmental partners. WHO is an important partner. Different ILAB members that are maybe active in your country are important members. Nippon Foundation, who supplied NDT for a long time, and also has lobbying activities over the main in the main endemic countries. And last but not least, patient organizations are an important source of lobbying and other sorts of help. Unfortunately, there are not many countries who have patient organizations like in Brazil, Morhan, and but hopefully this can increase and will increase, because it would be an important source of pressure on governments to increase commitment, I think. What does it mean, increased political commitments for leprosy? If that is the case, then there will be improved access to high-quality health services, of course. The training would be improved, would be better, would be updated, would be more. The supervision would be organized in a better way, and staff would be better motivated because they have, for instance, a better remuneration. And the remuneration is not only financial. Of course, everybody wants to have a good salary and a better salary, but sometimes career options can be also a good motivating factor, I think. Let's go one by one to these different points that will occur when political commitment is improved. 1, improved access. And of course, improved access means mainly the adequate supply of NDT and anti-reaction medicine. Without that, there's no leprosy program, of course. And you have to assure that it's affordable to patients, and you have to diminish the obstacles that exist for people to use these services. There are two other factors that involve mainly human resources. One of them is the decentralization of leprosy services. So often, leprosy services are concentrated in the capital of a province or a state, and everybody who is so unfortunate to become ill in a remote village will have to go very far to get this treatment. And the second one is also important. You have to ensure acceptability. Staff behavior can be good, can be moderate, or needs improvement. And sometimes staff are not very friendly to patients. They are thinking about other things, and there may be a need to humanize staff behavior. Also, in the case of leprosy specifically, there is stigma. There's stigma by every person in a population, or most people, and that includes staff as well. And if health staff has stigma and has fear to deal with leprosy patients, of course, it will reduce the access and reduce the possibility for Maria to get proper treatment. Second effect of increased political commitment. You get better training capacity. And in the field, sometimes, or most of the times, training is done automatically. We give training, Ministry of Health or other organizations, they provide training, and they do provide training every year. But sometimes it's not very well thought of what should we train. What should we not train? Imagine, for instance, a community health worker doesn't need to know the size of Mycobacterium leprae. It's not interesting for him or her. The community health worker needs to be able to suspect leprosy and be able to suspect a reaction. A medical doctor has other training needs. They need to know more academic subjects, they need to, etc. So, considering what to train and how to prepare training packages, training courses, sometimes people are doing in considering what subjects to train, it is a good idea sometimes to do a training needs analysis. And I will go a little bit into that in detail. What is a training needs analysis? The training needs analysis has several steps, but I mentioned here the three main ones. First is a capacity needs inventory. You need to know what tasks are being done by different category of persons, health staff. Like I mentioned, the community health worker, physicians, physiotherapists. And what sort of knowledge, skills, and attitudes does this staff need? And if you know what they need, you can know what to train and how to organize training. Second point, performance analysis. You should know, before you start making a training program, what are the reasons why are people good and why are people not so good in diagnosing and managing leprosy and leprosy patients? Is there a need for training, or are there other reasons more important? If you do this performance analysis, you can identify the main areas for training. This they should learn, this they can learn, this, etc. And then from there on, you can compose the training solutions. What are the priorities? What is important to teach? And what is important for the staff to learn? And define packages, training packages in the form of courses or online courses, or there are several different methods to train people. There are different training methods, and a lot of things can be done online, but there's no way you can teach leprosy without having health staff being trained in the presence of patients, examining patients, and doing the tests necessary, for instance, for nerve function assessment. 3, supervision. I talked about it a little bit before. Supervision is a neglected part in many programs, and I find it so essential to develop and maintain human resource capacity. It is a way of on-the-job training, and it's not just an inspection saying, are you doing a right job? If you're not doing, I will report you to the superiors that you're not doing a job. No, you should, on supervision, you should bring something, not only take away things. For instance, supervision, it would be best to have it systematically. Every month, the health center X will be visited. They know that on the 3rd of October, the supervisor will come and to supervise you. If you have, for instance, a difficult clinical case, you can ask this patient to come back on the 3rd of October so that the supervisor can help you with diagnosing or managing that particular patient. You need guidelines, how to supervise. You need checklists. What are you supervising? What are the different parts of supervision? All these things should ideally be organized. The fourth reason and the fourth aspects of an increased political commitment is that the Ministry of Health and other organizations will take care of career development. How often do you see nurses, doctors who are there on their position for a long time and they have no future to expand their knowledge, maybe do courses, maybe take another professional course, maybe go for a master's degrees or even further for a PhD. These are important factors that will motivate people to keep working where they are. There are also material and non-material incentives. You can pay risk allowance for infectious diseases. You can provide housing allowance. There are several ways to motivate staff to continue working in the job that they are doing. Okay, so if the quality is improved, what would be the result? Of course, if the quality of staff and the quality of human health services improved, there would be an earlier diagnosis and effective treatment of leprosy and all its complications. And this improved quality would mean improved quality of life for Maria and so many other persons, avoiding a clawhead and avoiding all sorts of deformities. Capacity development, as we talked about it just now, is more than a training program. Let's look at 3 levels where you can develop the capacity of human resources in leprosy service and in whatever other services, by the way. First is the individual part, human resource development. Developing staff, as I talked about a little bit earlier, for training and supervision, for instance, and career development. The second level is the organization level. A national leprosy control program should increase and maintain a good quality organization. How is the structure? What are the procedures, etc. And the third one is the context outside the leprosy control program. It's the Ministry of Health, maybe it's the Ministry of Planning, maybe it's a ministry or a regional or a provincial ministry department that deals with human resources, with payments, and you need all sorts of coordinations to make that as optimal as possible. It also means, the context also means acting on human rights. It also means in looking and checking for laws that prevent leprosy patients to ensure leprosy patients can enjoy all human rights that are applicable. These are all the context things that are important for capacity development. So capacity development, as I hope to show, is only part of the solutions. There are many other factors that will determine good quality of services. I have come at the end. In a summary, I write here what I try to explain in this lecture. The case of Maria with her claw hand as an example, how to analyze the different causes and the relationship between the causes for this unfortunate result. I use the whys analysis, the 7 whys in my case, to come to the root cause of political commitment that could be improved to avoid this result. And I said capacity development is a partial solution, and there are of course, there are other aspects that should be considered. Thank you very much for your attention, and Info Hansen and me will be happy to take any questions that you have for this. Thank you very much.